Hello, everybody. Good morning, or good afternoon, sorry. This is Mariano Lu from representing the Florida Healthcare Simulation Alliance. I want to welcome you to this new edition of this webinar. Today, we have a very exciting topic, especially those that are interested on the, I forgot something. Let me record this.
Accreditation.
Recording in progress.
So today's topic is going to be related to SSH accreditation, especially for those. This is probably a really great topic for anybody looking into accredit their sites. We are looking forward to listen to Andrea from AdventHealth in Orlando area. Following that, we are also very appreciative of the uh, kind and generous sponsorship for this webinar from IBS, from Joe Gibbs. He's going to give us a kind once he's going to follow up Andrea for a little bit of talking about the importance of accreditation for video recordings for accreditation. Please stick around. He's going to give us a brief explanation why it is very important. Without any further ado, please, Andrea, the floor is yours.
Mariana, 1 second. Just a gentle reminder that if you are not currently the speaker of our presentation today, to please mute your mics. I'm pretty sure Andrea will give us time to ask questions. Thank you so much.
All right, good afternoon, everyone. Can everyone hear me okay? Yes?
Yep.
I'm gonna come off and say I apologize for any background noise that you may hear. I am on PTO. I'm in Tampa at a children's museum, so a lot of kids don't want to leave the place, so that may be the sound, but no one's torturing any kids in the process. Okay, let me share my screen. Okay, can you guys see this?
Yes, but you're not in presentation mode. Okay, now you are.
Now I am. Okay. Great.
Mariano,
Okay.
can you mute everybody but Andrea? Do you have that availability?
Okay. So I will begin. If anyone has any questions, please feel free to type in the chat, and then Mariana, if you can please let me know if anything comes in that I should address. But again, good afternoon. My name is Andrea Morales. I am from AdventHealth. I am the manager for simulation accreditation and impact. So I manage the SSH accreditation journey, and then I also work on different projects related to simulation in regards to community outreach, different high school events, STEM events, CPR, first aid events in the community. We also do like a value impact analysis on certain programs. So a little different projects that certainly relate to SSH accreditation. And so today I want to emphasize we are not accredited yet. We are planning to submit for this next cycle in the summer, but we are not accredited yet. I want to make sure what the goal today is to share with you all our journey so far, hopefully give you some ideas, possibly get some critique or some suggestions from you all. And so without further ado, I will continue. And so the overview for today, or the objectives overview, I should say, is we want to overview AdventHealth as an organization, and then zoom in into our Florida, Central Florida hub and East Florida. Wanting to talk about the journey of accreditation being validation of what you're actually doing as opposed to aspirational. We really were wanting to apply for the February cycle, but we knew we had to really validate what we have in place. Wanting to review each of the sections for accreditation that we're applying for. So the standards core, and then we're also applying for teaching and education. So my goal is to review a general overview of our section, what we have for each section, and talk a little bit about that. I want to review, talk about helpful tools and different things that helped in the processes, and education plan, and then maintenance on accreditation regarding annual reports and the maintenance, to making sure that this is a living project and not retroactively having to go back and look for things. So realize this is blocking. So AdventHealth overview, established in 1973. We have over 52 hospital campuses in 9 states, different business lines as well, home health, hospice, urgent care, offsite EDs, in which we're actually really involved in, which I will speak later on. This highlights AdventHealth's different divisions. And so what we're focusing on is the Central Florida and East Florida divisions, which is what makes up our simulation program. So those are the 2 divisions within the state. So Central Florida division, this highlights our main hospital campuses. And so the highlighted ones are where we actually have simulation footprint, either in lab or center forum. So we have in Orlando, in our NICU, we have at East Orlando, at Altamont, Celebration, Winter Park, and then 887. It's not a hospital campus, but I wanted to highlight this because this is our largest regional training center as of today in Central Florida Division. And when you're going to start your application, or at least navigate the application portal, which I highly suggest, and they determine if your status is deemed of getting access
Recording in progress.
simulation sites in which we are going to be applying for our multi-site SSH application. So I wanted to talk about we as an organization, and I'm sure many of your systems and organizations, going through different restructures. And so we recently went through a restructure into where the learning technology simulation and training is our simulation program. We integrated within the nursing professional development department. And so we fall under the nursing professional department, and they're it's a nursing professional practice model, which includes, it's all encompassing patient and family centered care, and then diversity, equity, and inclusion, nurse well-being and safety, professional development and growth, innovation, autonomy and leadership, nurses' voice and governance, relationship-based collaboration, research and evidence-based. So this is what encompasses the NPD model, and it aligns with our AdventHealth service standards, which are keep me safe, love me, make it easy, and own it. And it's really encompassing and really a great way for simulation to integrate with all of this and being able to provide that whole person care, not only to our communities, but also that development and that growth for our staff. This is an organization chart for the NPD leadership. I'm not going to go too much into this, but I wanted to highlight the green area, which is the learning technologies and simulation training, which is the teams that include the simulation. So we offer the green is what is involved in actual simulation operations, and the other teams are more involved in the education and onboarding and nursing operations. And then actually some of the team members from the clinical learning education team do facilitate some of the trainings, but they don't actually operate or execute the simulations. Can you guys still hear me?
Yeah, we can. Yep.
Okay, sorry. Okay. So for the SSH accreditation overview, many of you may already be familiar with the documentation and all the packets, but there's one thing that I highly recommend is print your companion documents and always have them with you. It's really important for you to understand what's being asked. A lot of the sections can be asking a lot of the same things, or a lot of the information overlaps. So I would suggest definitely print these out and send them to everyone that's involved with accreditation. And especially when you're in work meetings and people are trying to give suggestions, you definitely want to keep these in line so that you ensure you follow within guidelines. So the course section, these are the main sections regarding the main sections for core. And so I'm going to highlight key information and how we're targeting these. And so I assume everyone's pretty familiar with the categories and with the companion documents. So I hope a lot of this isn't foreign to you, but if you have any questions or need further clarification, please let me know. So I'm going to try to go as quick as I can, because there is a lot of information to cover. So regarding starting with core, with mission and governance, so they want you to have your mission, vision, your values, making sure you have that established, making sure that it aligns with the types of simulation programs that you're actually executing, and then making sure that your staff knows your mission, vision, and values, and is really living and breathing it. We also have these posted at all of our simulation facilities, so that it's visible and people see it. We also have it on our LTST SharePoint, which is our internal organizational website. So all of those are requirements as to how you have your mission, vision, values displayed, and making sure that your staff is aligned with it and understands it and can recount it, right, if asked. The other requirements are basically the organizational charts. And so again, I'm not going to spend too much on these, but I want to highlight our main simulation team. So we have our new hire orientation team, and they basically run all of our new hire simulation programs, from our nurse residency programs to our nutritional services, mainly all those new hire onboarding programs. And they service some of that team also service the East Division. They service East and Central Division, I should say. The service line and campus simulation team. So this team is it's based in Central Florida Division, and this is the team that has the lead simulation operations specialist at each of our simulation sites at our locations, either our campus, our hospitals. And then the other part of the team runs more of the service line programs. So let's say, for example, Cindy, I'll use the example chemotherapy, which is an offered training to chemo nurses all throughout within the system or within the division. So it's those type of trainings that it's not necessarily new hire, but more of those service lines. So this is a team that runs this, and then our simulation learning strategist, Cindy, sits on this team, and then the new hire orientation team supports their program development as well as the East. This is our East Division team, so it's our simulation center at Palm Coast houses these team members, and the East is really ramping up their simulation activity. As I mentioned, they're a plan for a regional site center opening up later this year. So they're ramping up a lot more training, especially as our recruitment efforts increase. Simulation operations and support. So I wanted to highlight this team. They are basically, it encompasses our standardized patient program. So we have a pretty robust simulation patient program, over 60 standardized patients. And we also have some coaches, standardized patient coaches, and an educator. And so this team houses this SP team houses within this team. And then the other part is the logistics team. So think about your maintenance, your procurement, your preventative maintenance, corrective maintenance. We also have an innovation lab that creates new innovative trainers and different technology and 3D printer and all these great things. And then we also have informatics, which I'm sure Mr. Gibbs will tell you that it's one of the key elements when it comes to simulation and making sure that your AV is working correctly, and not only that, but the compatibility within the overarching organizational network, and it can be a little difficult. So for our simulation governance structure, so our members, as I mentioned, we went through a restructure, and so we historically had what was a simulation coalition meeting, and it basically took the essence of a governance structure. But now, after the restructure, it's official, an official council, and our members include the directors of the NPD team, so clinical learning, education, and onboarding for both CFT and EFT, the directors for new hire simulation, service line and campus, senior manager for nursing operations. We have our simulation learning strategists, Cindy and Brad. We have simulation operation managers, so that more of that frontline representation, and then myself with impact and accreditation. So our function, as you know, SSH is not very prescriptive as to what is actually the function, and it's going to look different for everyone. We have a governance council, and then there's also other committees that some of our members are part of that you could also incorporate those to fulfill this section. But our functions is the strategic planning, making sure we're following best practice, and that also involves a lot of the accreditation efforts. We for programs that are intense in resources or resource heavy, that are not existing and that not have been budgeted for in the current year, that is another thing that comes through these council, and the function is to see if the project or the program is in alignment with our strategic imperatives, or and then making sure that we could support it in long term. We provide advisory for technology and different advisory. And then the main takeaway is, like, what is really driving decision making in your governance structure. So that's the main thing that we have to think about when satisfying this requirement. And uh, and again, it may look different for everyone. Any questions so far? I will say something about org charts before I continue. They can, how can I say this? They can change quite a bit. So just make sure that you keep up with the changes and make sure that you review them periodically. And as that communication starts flowing about what transfers or who left and who came back, especially as your team gets bigger. For the second part of core, the second standard is the program management. So this part, first off, is they're wanting to talk about finance and budget and sustainability and how all of that works. So I'm not going to get too into the detail. Again, that's going to look very different for everyone. What I'm going to say is include your finance team early on. Make it easy by including the requirements. So, these companion documents, they're the best. I live and breathe them, and they're the best, right? But when you send them to people that don't really, don't have as much buy-in or don't really understand, because it could be very overwhelming, it's easiest just to do a shared document, literally write the requirements that need to be fulfilled and send it so people can fill in their parts and then that was one of the best ways that I could say worked for us. And then make sure that executive leadership, especially your finance leadership, is ready to be interviewed and ready to speak on the sustainability of the program and moving forward and items like that. The other part is the operations oversight for program management. So they want to see what is your process for day-to-day oversight and the coordination of operations and making sure that everyone is up to date with information and with scenarios and different content to support different training. So again, this looks different. We have different huddles, meetings. We use Teams meetings quite a bit. We have, so huddles and meetings and all of those sync meetings happen like at the individual team level. And then there's also bigger meetings that happen like at a department level, like our operations meeting, where I can disseminate specific accreditation information or updates, where people can deconflict different vehicle issues and things like that. And then another 3 bullets that I wanted to include that are considered part of how we operations oversight is our SIM data form, event data form, and our Power BI. So this comes up in a lot of the other slides, but I'll mention, so we do use Smartsheet, and through Smartsheet, we're able to capture a lot of the analytics and a lot of the information regarding what like throughput and what the requirements, what the resources for those throughput is. So after any simulation activity, the lead SOS is required to complete a SIM data form with all that information, and then that feeds to our Power BI. It's all real-time dashboards. But the event data form is the same concept, except we use this form to fill out any completed events that were not simulation. So talk about like meetings or conferences or community outreach events, community benefit events. So all of those are still captured in that event data form, and then that all feeds through our Power BI. For the required SOPs for SSH, as you know, there's 7 that are required. I will say just check in with your legal team, check in with your overarching organization. There are already policies and SOP that give you that guidance or that framework within what you can work with. What I've realized is SSH isn't prescriptive. Also, they give you guidelines, and there's great resources out there, and like the SSH policy manual, that was very helpful. But again, just make sure you check in early with your legal, see what's existing so you can know what to work with, and keep your documents handy. The SSH policy manual, that was very helpful in giving additional information that perhaps isn't captured in these companion documents that could help you think through these. So I'm not going to go too much into these, but what I did want to mention, some of the ones that we really had to work through is like the separation of simulation and actual patient care materials. So that separation of simulated equipment and medication versus the real thing. So we know the risk of not properly labeling, and it's more so that education for our team members, like why it is that we do the things that we do. And then so our standard is these neon green stickers that are on our simulated equipment, medications. And then I wanted to highlight this non for human use education only image, the symbol. I know it's from Healthy Simulation, and we are all very familiar with it. So it seems like, is it Pocket Nurse that is going to be embedding these in all of their medication? So that's thoughtful information that we learned from in conference that we were able to prepare for in advance, and let our teams know of perhaps the upcoming changes that may affect us. The other thing I wanted to mention with this one, going into the storage and maintenance of equipment and supplies. So this SOP is pretty much straightforward. And for this one, we needed to find a way to make sure that all of our equipment, specifically our code cards with our SimMed drawers, were locked when unattended. So this is, let's say if we have in situ simulations, and there isn't a storage room or a locked room available, we can't keep our equipment there without it being properly locked. So this was a project that Scott Pinky, our innovation lab SOS, completed. And so now all of our code cards are going to have this flat bar. They may already, I know this project was underway, to make sure that we satisfy that requirement. And so what I wanted to highlight is a lot of the things that you're going to be working on to get accreditation worthy or to meet those requirements will be good examples to actually include in your accreditation, as you'll see in the next slides, for like your process improvement initiatives and those type of things. Again, with SOPs, I'm not going to really take too much time with them. That it's going to look very different for everyone. What I will say, I mentioned checking with your legal teams. I wanted to mention consent forms. So our legal team drafted some consent forms. So the way we have our forms is, so our simulation confidentiality agreement, basically what happens in sim stays in sim. I'm gonna follow all the sim rules. I'm not gonna take anything. Like all of that agreement is through our Adventist Learning Network, our web-based training program, and they have it to where learners are able to scan a QR code and complete that attestation, and then the facilitators are able to go back and pull a report from the learning network to see if anyone did not sign it, or even going on to the next bullet, the simulation video recording consent form. So it works the same way with the QR code through ALN. We wanted to keep these separate because not that we record everything and not that we record a lot, but we want to give that option if someone refuses to be recorded, then we can do proper accommodations, like set up another room or just not record, or have the learner as a in the viewing area. So there's just different accommodations that can be made. And then I also wanted to mention the other form that we have is specifically for our standardized patients. So it is the ultrasound recording photo consent and treatment waiver form, AKA this is your incidental finding forms. So if during an ultrasound sim, something is found on one of our SPs, then that form would remove us from any liability for further treatment. And so we have the standardized patient incidental findings process, and that is our SOP. And the process is indicating through your SP request form that you are going to be scanning, and then have that form ready for the day of. And then from our legal guidance, it was every SP so there must be one form per SP per body part was the guidance from legal. And again, that's going to look different, but I did want to highlight that. All right, any questions before I go to resource management? All right. So with resource management, they want you to explain what modalities you're using. They also want you to include a list of your equipment and all their different resources. So on the application portal, and that's why it's helpful for you guys if you're able to go in a little early and explore, see how the attachments work, because each section, you have a section to fill out, right, to your description, and then there's a section for attachments. But you may have more than one attachment, and they want everything in one file. And so making sure that you consolidate all your proper documents, and like the catalog, like our equipment catalog is like, I don't know, over 100 pages or something. And so, thinking that through, and that could all take some time. And the other part with resource management is I guess I didn't include it in here, but talking about your maintenance. So who's responsible for your maintenance? Do you have preventative maintenance in place, corrective maintenance? So they want you to talk through all this. And so we have this section highlighting our logistics team, and they've been they've been vital in how smooth operations run. If there's a mannequin that is out of commission, troubleshooting that, or just making sure that everything is on the same version and everything is talking to each other. So that's that section for resource management that they also want to elaborate on. The other thing for resource management, they want you to include all of your sites. They want you to include pictures or blueprints, maps. So as I said, we're applying with more than one, actually with 7. But I wanted to include East Orlando. I used to work at this site for a very long time, so I'm a little biased. But I wanted to show this, how our blueprints look. We have a quick facts bullet. And then we did ours through Visio, and then we also have these available on SharePoint for all of ours. And, these are very helpful, just even in planning sims as well, to make sure you have that visual representation of where things are going, the schedule, rotations, and so it's very helpful to have those. Okay, the other item they want you to talk about is they want the annual simulation hours per site. And so again, this is on that portal. It's not under core, it's not under teaching and education. It's like that basic information section, and they want you to list, I believe it's 24 months of sim activities, and then total training hours, total learners hours, and they do have that formula that they expect you to use to obtain those. So remember how I talked about our smart sheet feeding into Power BI, and so this is a dashboard that our data guru created for me, and I just have a screenshot on there, but it's interactive to where I can filter for 2022, 2023, or both, and then it lists per site all of the requirements that or the information that I need to pull, basically. So that's it. Sorry. So this is that dashboard. And again, that's why I wanted to highlight those bullets, because all of that feeds into this. And then we're not having to go back and scramble to calculate. It's very easy moving forward. With section 4, human resources. So what I can say about this is gather your job descriptions early. Your bio sketch, make sure you send that out early, and make sure you just don't send the bio sketch, send out the instructions and the example that they list. And when you do receive those bio sketches back, make sure you review them for your team members. I had to go back and just, there was so much more information to add that was relevant to simulation that these individuals did. And so it's just, I wouldn't say beefing it up, but really helping them fill it out to to their fullest potential of what they're doing, and it may not consider, to include it in the bio sketch. And that is, SSH does want you to use that template. So that template is on their accreditation page. The other thing for human resources is they want you to describe and document how do you properly train and onboard your simulation staff, right? So the way that we have our onboarding, again, we have our ALN, our learning network, and we have a checklist. And so we've divided them into 4 checklists, general simulation related checklists. So one of them is for our general simulation staff. The other one is for standardized patients. The other one is for simulation learning strategists. And then the last one is simulation operations specialist or operations. So given on your job code, wherever you fall on these, you'll automatically get one of these checklists assigned to you via ALN. And then your leader is responsible to make sure they review all of those items with you within the first 90 days of hire. And so this has been helpful because we can go back and make sure that we are in compliance and we can pull reports. And I keep them general enough as to it includes the information, the simulation specific information per their role. However, we don't need to be going in and making little changes. We have our checklists, which are pretty general, and then we have the supporting documentation that we will be submitting as support, and that basically just is a review of the onboarding content or the training content for these positions. So like the SOS onboarding agenda and things like that. So it's a further step of demonstrating to them what we use to train our simulation staff. For professional development, so we actually since 2020, our service line and campus simulation team, I was actually part of this team when or on the way out from this team, but our SOS professional development series. So it's a way for our internal SOSs to learn from each other, and then also professional development and being able to present and teach. And there's different topics that are covered during these development series. So for example, like smart book development, like how do going through developing a smart book, and I'll explain what that is in the future. But so that's one of our professional development items. We also attend industry conferences, and we share information, bring ideas back, a lot of collaboration with other healthcare collaborators. And then we also have professional development symposium. We actually have our first nursing professional development symposium in September, I believe. And so there's different ways that we provide that professional development. We also have talent care, which is our evaluation tool that we use, our performance evaluation tool. And so we're also able to incorporate some of those specific simulation goals or professional development simulation items in those talent care conversations. All right, any questions before I go to program improvement? All right, for program improvement. So for this section, they want to make sure that you have a quality management system in place. They want you to know they want you to provide documentation for the systems that you're using, and also including examples of past examples using that QI or PI model. So we use the PDSA model, Plan, Do, Study, Act, and so the three examples that we have is our SOS Professional Development Series, our onboarding process, and our IT ticketing support documents. And so we have those PDSA cycles for each of those examples that we'll be submitting. And we are also have a it's and it's actually something that we're working on now, is being able to have a standard tracking method of all of the different incidents or concerns that are reported from the different avenues, right? From debriefs, from just in person, all these issues or concerns that are raised, and so that we can actually have visibility of what's going on within all of our simulation sites, to see if it's a recurring issue somewhere, or if it's something that we can mitigate. So that's actually in the works, but again, no prescriptive way of how we really obtain that information, since our team is we're so dynamic that information comes in from different ways, and then those that are that have that potential to have that to be used as an example for program improvement. The other item I wanted to mention with program improvement regarding complaints and concerns, we have a QR code at each of our simulation sites, and basically it says if you're unhappy with something or concerned, anything of the sort, people could scan that QR code and submit the smart sheet, and it just they can list their complaints and concerns, and then that is routed to the one of the managers on the Shannon Kelly, our support and operations for simulation manager, and so she receives these, and again, that's another way that we receive those that information, those complaints. The sixth part, and any questions before I go to integrity? So with integrity, our ethical standards, we follow SSH Code of Ethics and Axel best practices, and what we include for what we have as our service standards really keep that integrity in line, of that keep me safe, love me, make it easy, and own it. And actually our organization has an initiative where team members can actually nominate their peers for service standards awards, and this is organization wide, and some of our team members have periodically received those for different reasons. So that's the integrity part, and again, this may also be in alignment with your organization if you have that. Expanding the field, so they want to know that at least one of your staff members is part of Healthcare Simulation Society or Association. So SSH, and I think FHSA is also it also counts towards that. They also want you to list examples of extending simulation, if you will, the simulation knowledge in the community, how you're supporting or contributing to knowledge of simulation out in the community. So we can list many. I wanted to highlight a couple. So our team members have presented at different conferences, including IMISH, plenty of times. We have a lot of CPR, hands-only CPR community engagements in different high schools. So that's also part of some of our examples. We have STEM events. We do tours with community leaders, politicians, different organizations, different clubs wanting to come. I know I had a lot of K through 12 teachers come and tour and meet with me at East Orlando to learn a lot of the STEM or the STEAM initiatives that I was doing that they can bring back into the classroom, and it is simulation, right? And then a few of our team members have also been involved with the development of the exams and very active in that SSH community. All right, any questions? I see there's something on the chat. I don't know how long that's from. Did you have to create all your SOPs? Do you have place for templates that can be useful? So yes, we had to create all of our SOPs. The overarching organization SOPs were used to guide the development, and a lot of experts were brought into the development of those SOPs because of just the nature of them. And I would say every organization has their own templates in the sense of how they want it laid out and specifics. What I will say is the SSH policy manual, that is a great resource, and it'll give you a good guidance also on how to develop your SOPs. I hope that was a good answer for that. All right, for teaching and education. So these are the sections for teaching and education. And so here. So for teaching and education, so going back to aligning our educational activities to the program's mission, vision, and strategic planning, they want to know that, again, our education activities are in alignment with that. And so our VP and executive director do review education activities quarterly. And then in addition to, in that simulation governance council, if there are any new proposed programs or projects that are, again, very resource heavy or resource intensive, then those programs are pitched to the Sim Governance Council to see if it's viable, if it makes sense, to support these. And so our simulation experts, Cindy Price and Brad McLaughlin, they're our simulation experts. So simulation learning strategists, and Cindy's our senior simulation learning strategist. So they're the ones that write all of our simulation scenarios in collaboration with the department educators that are considered the SMEs in their area, and they're the facilitators. And so I'll talk more about that in the next couple slides. In regards to educational activities, so they want to, they want you to submit examples of activities that yeah, they want you to provide up to documentation for up to 3 simulation activities delivered by the program, and they want it all. They want your needs analysis, your goals, objectives, scenarios, schedule, pre and debriefing documents, evaluation forms. And so we have what we call smart books. And so these smart books basically tell you how to set up, execute, how to execute a simulation program from beginning to end. And so some of the smart books that we have that will be submitted for as examples, post-preceptorship, chemotherapy, and neuro principles of neurology simulation. And so that's on the picture on the right, that's just the front page of the smart book. And so we have one for all the programs. And they also want to view up to 3 live simulation educational activities. So we will either it also depends on when they're going to be visiting, right? So what's on the schedule. We are probably going to have clinical immersions going on during those times, and we also have those recorded. So that's also an option, but we're not prescriptive as to which ones will be happening. So with the educational activity design here, they want to know how the program's assessing the need for some education activities. So it's different avenues with our different divisions or different departments, but through needs analysis, gap analysis, expert assessment, even learner requests. Some learners just want to practice a skill, or they want some hands-on practice. Regulatory requirements, and then we do use the ADDIE model for the design of our educational activities. And so the next, this is an image of the ADDIE template planner via Teams. Okay, so this, okay, okay, okay. Hold on one moment. I'm sorry, can you, Sydney, can you take on from here, please, really quick?
So we can go ahead and take over on the ADDIE model. Okay, so on the ADDIE model, what we did was we took basically how we consult with our customers, and we embedded into the instructional design. Sorry. You want me to go on this one? Okay. So on so on the ADDIE model, we use the instructional design template here to do our consultations and our needs assessments. So it's analyze, design, develop, implement, and evaluate. So these are all pretty much lessons learned that we have embedded into here. And it helps us track and keep our customers accountable with us as well. Next slide, please. So examples of our design process. So our post-preceptorship, it's like 3 months after you come off orientation as a new nurse. We then implement a post-preceptorship simulations. So it's taking like Glue Commander, like learning how to change out your insulin drip and modify that, or heparin drips. So that's something that we did. So we work with those teams. We create the simulations, we design them, rehearse them, and then go live with those simulations. Chemotherapy one, I wanted to highlight, that was that's a certification. So we developed simulations around chemotherapy certification, and we actually got our scanning up and running again since we changed over to Epic. So with this one, we were able to auto program there. They scan the bracelet, scan the medication, scan the IV pump, and it auto starts the chemotherapy. So we also do other things like opening new facilities with simulations. So those are some examples of our designs that we do, and we use the ADDIE model in each one of those from start to end to evaluation. You can do the next slide. Simulation consult and evaluation. Yes, this is embedded into our ADDIE model as well. And this was really part of the accreditation process to ensure that We are choosing the a collaborative subject matter model. So we use our interprofessional education. The SLS helps choose the modality when they're doing that needs assessment, whether it's SP based or mannequin based or, TRAS trainer. And also our objective-based scenarios and our objective-based evaluations. So we take those objectives that are embedded into the simulation, visit them with our debrief, and then we also take those same objectives and embed them into an evaluation for the learner as well. And then we track all of that data.
Thank you, Cindy. Thank you. So yeah, that's exactly in the simulation consult. That's where all of the intake is received, and it's decided if simulation is a proper modality, and then if that approval process is needed forward, that's where that goes into the sim governance committee. And then I also wanted to highlight the Simulation Innovation Lab, because this is also the moment in which, if there is potential for a new trainer to be developed or enhanced or anything of the sort, this is the time in which that consult to the Sim Innovation Lab would be taken place, and the creations that our team has made are amazing, and so that covers that section. The third section for qualified educators. So this section is not for your simulation for your simulation SMEs. So this is talking about all the individuals that are more so facilitating your sims. And so in our organization, we have our department or business unit educators. And so when they are interested in doing a sim, they do the consult with our SLSs. And then if deemed appropriate, then they would go through a simulation facilitator training, like a professional development, if you will, for simulation. And so that takes them through Sim 101, which there's 2 parts. And then it gives them all the information that's needed to effectively facilitate simulations. And then they're also evaluated in different ways. And in the standards, they're clear that they want your facilitators to be evaluated in more than one way. So we have our learner evaluations, which Cindy alluded to for all of our sims. We have a post-sim evals that our learners complete. And then we also have peer-to-peer. So where facilitators peer review each other. And so that will also come in the next few slides. But for educator orientation and development, so that training, that orientation, a lot of that happens in the Sim 101. We also have an ALN course on standardized patients, on proper use of standardized patients. Other forms of evaluation and feedback for our educators or our facilitators, we have rehearsals, we have dry rehearsals. The new hire orientation team has facilitator observation. So before they can facilitate on their own, they have to be observed a certain number of times. This section is also asking how facilitator concerns are brought about, how they're communicated, and how they're followed up. So again, this is very different for all the teams. Some concerns may come out from the post-learner evals. It may come out through just verbally or through a debrief. So just making sure that those concerns are being communicated, escalated, and followed up. We also have the post-sim learner eval form of feedback, and then that peer-to-peer evaluation. And with leading to the next part, the evaluation and improvement. So we have the annual program review where we review our programs annually. That's through Smartsheet. We also do it in a team setting where all of the teams do the annual program reviews for the new hire orientation teams, those bigger scale programs. It's typically end of year time frame when those are evaluated. And then the way that we have it automated on Smartsheet, it automatically notifies the lead facilitator for the programs when they also have to complete their peer-to-peer evaluations. So make sure that we're in compliance, not just for the facilitator evaluations, but the annual program evaluations, and making sure obviously that's still meeting education objectives. There's no changes in regulatory requirements or policies, anything of the sort. And then they also want you to submit examples of changes to your programs from these annual program reviews. So some examples that we have were from post-preceptorship, where they removed the SEMI and added code. With the chemotherapy, they integrated EPIC finally. And then with neuro PONS, they added a fourth scenario. And some challenges that I wanted to mention, and I know I'm short on time, but the main things for multi-site is communication, making sure that everyone understands the same message and everyone is on the same page. The standardization of things could be very difficult just because of how the nature of events or the nature of teams at different locations are. So that could be a trouble. And then site support, I want to say site support, site buy-in, especially from that leadership that is not simulation related, because we really need to enforce that that best practices being followed, that we're doing simulation correctly, that everyone understands and respects our SOPs. So that site support is critical, and that's going to be different, especially when you're working with 7 different sites, right? Some resources and takeaways. So, Smartsheet has been great for us. OneDrive, those shared documents go a long way. Obviously, Teams, we did a Teams channel where everything's uploaded and people can make suggestions and real-time changes. The SSH policy manual, can't stress that enough. There's really great articles out there. Khan had a very great article, and I have his reference at the end. And then another thing is having a designated project manager, personnel, or a group, a team of 2 for accreditation, preferably they're subject matter experts, and making sure that you know your requirements, especially again in work meetings. People will have great ideas, but we need to ensure that we're on track of following what is, or following guidelines that are required. For education plans, so this is starting to roll out. We want to make it engaging, include Jeopardy. We are also developing some checklists for like internal audits to check on themselves, and preparing for interviews. We're not going to be prescriptive, obviously, how you respond, but potential questions that may be asked. And through the education plan that we're doing with our teams, they will know a lot of the answers and a lot of the things that they're already living and breathing and that they can anticipate to be asked. Those are my references. Any questions? I apologize for the hiccups. But yeah, that's that.
Thank you so much, Andrea. That was a fantastic presentation. We were so happy to have you come in, because I think that was a lot of useful information that people might have not known, and facing the challenges is a really good thing. So thank you so much.
My pleasure. Thank you.
Yeah, and it wasn't easy when you got tossed out of the building either. That was very, you did really well.
They gave me free tickets.
All right, so we are going to have a quick presentation from Joe. He's going to keep it very short as possible.
Yeah, absolutely. Thank you, Mariano, and thank you, Andrea, for all that information that you shared. As Mariano mentioned, we're really excited to partner with the Florida Healthcare Sim Alliance moving forward on these webinars and kind of sponsor the webinars. I work with IVS. I've met a few of you at IMISH, and I've met a few of you just kind of throughout my time here, through my 4 years at IVS and working with individuals throughout Florida. We provide Navy system, but really I just kind of want to talk about how our system has been used to help other healthcare organizations as well as universities through that accreditation process. So really just kind of quick to kind of present here, just a couple minutes of your time. Obviously we're running a little over, so want to be respectful of your time, but a lot of what Andrea spoke about, especially kind of in the middle of her presentation there was around data and around evidence, right? So beyond just needing a recording system to be accredited, right? That's one of the requirements of accreditation. Being able to pull evidence and data is very important. You mentioned just things like sim hours per site, debrief hours, things like that. Our system is really powerful in being able to do that. Here I have just some kind of standards from both CCNE as well as the ACEN. I know we're talking about SSH accreditation today, but all of them really run along the same kind of goals and standards. So something that we have within our system here, and this is just a screenshot quick, is a very searchable video library. So when you are looking for data, references, things that you need, whether that's maybe a specific task or a specific simulation that you're looking for, you can search directly in our video library, pull up all of those videos that would be tied to that specific individual thing. When you talked about resource management, you talked about needing 2 years of functional experience within different technologies to be accredited. You can have that proof right here within our system. And this is just beyond that actual powerfulness of having video being able to debrief. All of our library, again, is searchable, so you can search by resuscitation, debrief, whatever information you're looking for. A little bit further power in the system then, when you talk about recording systems, is you can actually pull a lot of that data that you're trying to gather, right? You're building spreadsheets, building dashboards internally. You can pull a lot of that data directly within the system via our reporting functions. Here's just showing just some reports of just, number of nursing sim program simulations. We have some where they're using specific techniques or skills. So if you are looking for specific skills training, specific skills information, that's all things that you can pull out within our reporting system. And in that reporting system, this is all tied to actual data within your videos, right? So you can actually tie that, you can click on that video, you can go to that video to prove that this is actual data from your specific system, your specific program, and help towards that accreditation process. So I'm really just wanted to kind of share a little bit about how video programs can be used and video systems can be used to work through that accreditation process beyond just having to gather all that data by yourself. You can use a lot of video systems, whether that's ours, whether that's a competitor's, to capture that data, to gather that data, to provide for that accreditation process. And it can be very powerful beyond just a video program to stream and debrief, right? There's a lot of data that those programs will capture, and then there's a lot of data that you can use throughout that accreditation process. But that was really all I kind of wanted to touch on, and just kind of supplement a little bit about what Andrea shared. I know we're up against time here and want to be respectful of everyone's time, but thank you all for joining. Excited to kind of run this series throughout the course of the year and work with you all and really grow the Simulation Alliance in Florida. I cover this whole Southeast US, so I'm also working with Auburn and Alabama to grow their Sim Alliance, working with the South Carolina Sim Alliance. So if there's ever any need that you guys want to connect with those individuals or kind of see what they're doing, I'm happy to facilitate those as well. But thank you all for joining. I'll kind of hand it back to Mariano, but feel free to ever reach out to myself or anybody from our team. We're always happy to support alliances like this and support groups that are furthering education and furthering nursing education. So thank you all. Again, want to be respectful of your time, but Mariano, you go right ahead.
Joe, do we have links to this stuff on our webpage, or can we get links to this on the FSH webpage?
As far as links to like our system, that kind of thing, links to this information?
Exactly. The information you just showed there.
Yeah, what I can do is I can provide this for you all. I know Mariano's going to send out kind of a follow-up. I'm not sure as far as what we have on the FHSA website. He's working with a member of our team to kind of update everything there and make sure we're all kind of good to go there. But yeah, I'm happy to provide that information or kind of display that for you all. I know it's important to be able to know that these systems can do that, right? To know that you can pull all this data from a recording system is important to know. And a lot of times that kind of goes to the wayside, right? When you look at AV systems, you're looking at the recording, the debriefing, right? Not the actual data you can pull from it. But yeah, I'm happy to provide that as well.
We appreciate your support.
Okay, thank you very much. So without further ado, I just want to thank everybody for coming today. So please feel free to, if you have any topic that you would like to present in our next webinar, you're more than welcome to submit your topic in our website. And so that's it. So thank you, everyone. Bye.
Thank you, everyone.